Greetings and salutations, ladies and gentlemen, and welcome to the first episode of my Neurology playlist. This playlist is going to be a small part of a series of playlists I'm going to call Medical ABCs. In the last couple of years I've spent studying medicine, I found it really useful to, with the addition of using association between certain medical knowledge, it's also useful to dissociate them using flashcards or watching random YouTube videos from time to time, etc. And so, without further ado, I guess we'll just get into this video, and starting off with the letter A. So in neurology, the letter A mostly corresponds to Alzheimer's, ALS, and maybe the Arnold-Chiari malformation. The Arnold-Chiari malformation, I'll probably discuss it in my pediatric playlist whenever that comes out, I guess. But for the most part, for this video, I'll just stick to ALS and Alzheimer's. Alzheimer's is the most commonly known neurodegenerative disease out there. It mostly affects the elderly, with some exceptions where it could be familial and it can happen at a younger age. Also mostly idiopathic. We still know the full mechanism of how this disease works. It is suggested that there is a problem with acetylcholine balance in the brain, specifically neurons that are mainly acetylcholinergic, and how their destruction is one of the major causes for symptoms in this disease. There is also clear correlation with genetical mutations, specifically mutations in a gene called APOE, responsible for encoding a protein called apolipoprotein E. Apolipoprotein E is an interesting protein. You can find this protein ubiquitously on astrocytes in the central nervous system, and aside from its function in lipid metabolism, it also serves as an immune mediator. It inhibits the complementary pathway and reduces inflammation. So I guess that's a little too much detail for this video, so moving on. In terms of pathophysiology, there are two majorly contributing factors, amyloid plaques and tau protein tangles, both of which are residual deposits of certain fatty proteins that were not broken down correctly. The accumulation of these molecules causes inflammation and progressive damage that will eventually lead to the irreversible loss of these neurons. As for presentation, for the majority, Alzheimer's presents in a sporadic way at a later stage of life. Point mutations and other form of genetic mutations can cause the inhibition of the APOE gene. This can be seen more obviously in patients with the APOE4 variant of the gene. Familial Alzheimer's occurs earlier in life and is also associated with the APOE4 variant of the gene. It's also important to mention that familial Alzheimer's is inherited as an autosomal dominant trait. The major genes affected are PENS1 and 2 and the APP gene, the amyloid precursor protein gene, to be more specific. As for signs and symptoms of Alzheimer's, I found a cool little tablet in Current Diagnosis and Treatments in Neurology. It's a McGraw-Hill's reference book, I guess. If you're interested, it's actually a really nice book. I found it really useful. So as you can see, there are two types of dementia associated with Alzheimer's that you need to differentiate. There is subcortical and cortical dementia. Subcortical dementia usually involves the most important of brain functions. These brain functions are necessary to maintain the survival of said organism, and usually involves attention and concentration and the speed of mental processing. Linguistic skills, however, you can find them in the cortical dementia, since linguistic skills are usually traits of higher beings, you could say, or mindful beings, and you wouldn't really find them necessarily in animals. That's a cool little trick to memorize that, I guess. For those of you who haven't figured it out yet, here's where cortical dementia occurs, and here's where subcortical dementia occurs. So one more time, you should be able to correlate higher brain functions such as linguistic skills with cortical dementia, since the cortex is the developed part of the human brain, and lesser or more vital and substantial functions such as attention, concentration, and the speed of mental processing with subcortical dementia. Moving on, the table also discusses the orientation to time and space and how it's impaired in cortical dementia. The way I like to think of it is, as we all probably know, the cortex, especially the parietal cortex, is responsible for receiving sensory information from the entire body, including sensory information from muscular tissue that allows you to maintain your 3D awareness, for lack of better words, your orientation in 3D space. It is also important to recognize the form of memory loss or impairment pattern in each of the subcortical and cortical dementia. In subcortical dementia, and I say it again, the cortex is fine, so the storage or memory storage is not affected. The form of memory impairment is a problem with retrieval of information as opposed to cortical dementia where the problem is with the storage of memory. Now, although Alzheimer's presents as cortical dementia most of the times, in later stages of Alzheimer's it can actually present as subcortical, and that is where the disease would be reaching its final stages and the prognosis becomes really bad. And in fact, the reason why I bring you subcortical dementia, even though it's a very unlikely presentation of Alzheimer's, is because in later videos we might discuss Parkinson's disease, which actually presents with subcortical dementia, and so you guys wouldn't be intimidated later on when we actually get to that. In fact, if you look closely at the last 4 rows of this table, you'd notice that in cortical Alzheimer's, movement is almost unaffected, and that is because movement being affected is one of the hallmark signs of subcortical dementia. Okay, so I know this video has probably gone on for a little longer than it should have. I was hoping I could also address ALS. Unfortunately, I think that I've already spent a little too much time on this video, and I should probably leave ALS for another one. For those of you who have actually made it this far, I'm really thankful, and I just want to tell you that since you've actually made it this far to the video, you're probably on the right way to becoming a really good physician, or just in general, you're actually really committed and are willing to put a lot of effort into learning, and that's a good thing. So I'll continue on with a summary of the video, then we'll do an outro. So if you have taken nothing out of this video, just keep these couple of notes with you, I guess. Alzheimer's is a form of cortical dementia. Sporadic Alzheimer's is associated with the Ep.4 variant of the APOE gene. Familial Alzheimer's is an autosomal dominant trait and can happen earlier in life. Usually it happens before the age of 50, but it could also be delayed. Beta amyloid plaques are extracellular clinical findings, whereas tau protein tangles are intracellular. And that's about it. So we have finally reached the conclusion of this video. I'd like to thank everyone who's actually watched it and give a special thanks to everyone who's managed to complete this video. If you guys actually liked the content, I would really appreciate it if you could like and subscribe. And the next video I'll probably discuss ALS, amyotrophic lateral sclerosis. And I hope you guys have a good one. Until the next video.